Hi, and welcome to a quick lesson on models. I'm teaching a class called Environmental Systems and Society. Systems are actually models. We have inputs, processes, and outputs. Those are what we look at to understand the outside world, the complex world around us. Um, Simulations are the second type of model. So we have systems and simulations. And simulations is what we'll look at today. Simulations help us understand a little bit about what's happening, the actions taking place, and also make some good predictions for the future. This can really help inform politicians and political decisions and help inform society. So I hope this kind of eases some of that stress out there, because a lot of us right now are going through lockdown, state of emergencies, countries and borders are being shut down, and this might offer some insight as to why this is happening. There's a graph going around social media. It's quite popular right now, and this comes from the CDC, Center for Disease Control, and it's trying to explain why we don't want this virus to spread very, very quickly. Even though there's a lot of people who are just getting flu or cold-like symptoms, so some people are saying it's not that big of a deal. The problem is if it spreads very, very quickly, it can inundate our medical systems, our hospitals. So the orange graph here shows that, and it's going beyond the dotted line, which is as much as the hospitals can take. It's the doctors working to full capacity, and all the materials that we have to serve these people. Once you go beyond that line, suddenly you have people in the waiting rooms and in the halls, and then people who can't have health care and triage and all these types of things. So the idea of flattening that curve is to say, let's keep people away from each other by social distancing them, and keeping them in their houses, closing the borders. And yet people will still get sick, and it's still going to affect a lot of people, but hopefully over a longer range of time when the medical systems can take care of those people one at a time rather than this onslaught. So I'll go through a few scenarios. This is from the Washington Post, and they run through 4 different scenarios here. And the first one says, well, if you don't quarantine, what happens? So let's just play this and see what happens. If you don't quarantine, and orange is a sick person coming into contact with a healthy person, you're going to create this very steep and quick growth of the virus, and you're going to overwhelm the medical systems. Sure, according to the model, it should come down as well, but what this doesn't show is the extreme cases of overwhelmed medical systems. And remember, that dotted line would be right in the first third of this curve. The dotted line would be down here. So the problems would the hospitals would be overrun in this simulation here very, very quickly if there's no quarantine. We call it a free-for-all. Another example is what happened early on in China, and definitely in Italy. They tried to close people off and keep them isolated completely in one spot, saying this should work. We should have a forced quarantine and everyone else will be healthy. Everyone over there will get sick. According to the model, not everybody stays in that quarantine, and that's kind of the reality. People get out really quickly as soon as they heard that there was going to be a state of emergency. It's happening here where I live in Romania. It's happening all over the place. People are taking off and getting out and taking that sickness with them. So you see, eventually you have the first close and then the second rise in population, and you still inundate the medical systems, causing a lot of problems for the older populations who are the most at danger because of coronavirus. Now we have a third simulation. There's 4 simulations coming. A third simulation talks about moderate social distancing, where 3 out of 4 people are in what we call lockdown, or just isolate themselves. You close yourself off, self-quarantine in your house or something. So only 1 in every 4 people can move. And now we start to see the spread slow down, and slow down long enough to allow people to also heal. There's a time gap here. They say about 2 weeks right now is the guesstimate. So if you allow people to not come into contact with each other, a sick person to come into contact with other people for 2 weeks, you're going to become that purple dot and heal, and hopefully not inundate cause a massive outbreak that will inundate the medical systems. So this one seems to be a bit better of a model. And the extreme would be extensive social distancing, or where in this case 7 out of 8 people are shut in their houses. The 1 out of 8 might be doctors, social workers, um, nurses moving around to get to work. In this case, you can see everybody sitting put, coming into contact every once in a while with a sick person who's on the move. Looks like it froze there, but it'll keep going. But you see that orange line on the graph at the top really staying low, and hospitals are able to deal with this. One thing is when people get extremely sick with coronavirus, it's a lung infection. It's a virus that affects the lungs, and 20% of the patients will require some hospitalization, and some of those will require ventilators, oxygen supply. So there's not very many of those in all the hospitals out there, depending on what country you're in. So if you can keep that number down, you have enough ventilators to support the public. So here you can see the difference between all 4 scenarios presented within this model, where there's a free-for-all, everyone moves around, and you see a very steep curve and a very high quick hit. With an attempted quarantine like in Italy, to moderate distancing, all the way down to an extensive distancing where only 1 in 8 people can move around. And it's quite dramatic, the effect that this has on something like the spread and the intensity of coronavirus in the medical system here. Now back to the notes and the class part of this. Just looking at some advantages and disadvantages of using models. The key here is to be able to understand something complex beyond a lot of us. This is a crazy new virus. You listen to the experts talk about it, and most of them, if they're being honest, they say, we just don't know. So this model helped us understand a lot about what's going on. And we can use models for other things as well, and we do all the time, things like climate change. It's too large to understand every single variable out there, but it helps us see a bigger picture. Also, very, very small things, how atoms work, or dangerous things like other viruses as well, like Ebola and things like that. Some disadvantages of using models. We just can't see everything, all the variables, all the things that affect people's movements. You can't see all the detail, so you have to guesstimate a lot of the time. And you saw in those models that I was showing earlier that there's no numbers involved, and that can throw you off in seeing some of these trends a little bit. We don't have the exact figures and the exact numbers. We're guesstimating again. And by doing that, there's a bit of oversimplification that comes into play. And people can twist that and use that. And you might see that in some far left, far right media using that to kind of manipulate their audience a little bit. And in summary, just to close real quick, when we started this, back to our class in particular, we've talked about systems, again, another form of a model, and this we just talked about simulations that show things moving and make some predictions. The better our computers get, the smarter you guys become and go out into the world and write programs for all these different factors in the world, the more we'll understand about it and more models we can create to help educate everybody out there and hopefully calm a little bit of this stress and tension and see some reason to this chaos that we think is going on around us. Okay, stay safe and relax at home, watch a movie, have some fun with this time, learn a new guitar song or start a new hobby. Okay, talk to you later. Bye.